You are watching the medical segment of the Jennylyn Show, and I'm Jennylyn Gleave, your host. On this segment of my show, various physicians will be debunking myths associated with their specialties and sharing what is new and cutting edge in their fields of medicine. Today, Dr. Katherine Sutherland, a great gynecologist, will be debunking medical myths associated with gynecology. Once again, you may be surprised as she debunks some very common myths. Hear what she has to say about getting pregnant while breastfeeding. Is this a myth? Stay tuned. You may discover that you too have believed some of these myths. Here is your chance to find out the facts and make changes if necessary. Here is Dr. Sutherland.
That's an interesting myth that you can't get pregnant the first time you have sex. Way too many people have learned that's wrong the hard way. You can get pregnant from the very first time you have sex, and young ladies should really be advised of that. People have heard the myth that you can't get pregnant when you're nursing, although initially, right after you deliver a baby, and for the first few months you're nursing, it's possible that you may not ovulate. But most women will start ovulating within a few months of having the baby. And even though they haven't yet had a period, they can get pregnant that very first time they ovulate. So it's important to use contraception unless you want to have two within a very short period of time. Women have heard that if they're a virgin, they shouldn't wear tampons. In fact, there's no reason why young women shouldn't wear tampons. Tampons allow them freedom to do the sports that they want to do and to enjoy the life the way they'd like to. By ignoring the ability to use tampons, they really cut out a piece of that life. Some women have heard that they shouldn't exercise or have sex during their period. There are no adverse consequences of exercising during the period. In fact, many women find that they have fewer cramps and less bleeding if they go ahead and continue to be active during their. Some people think that breast cancer is the leading cause of death in women. In fact, heart disease is the leading cause of death in women. Heart disease is responsible for about 50% of the deaths in women. A myth that has been going around the email circuit has been the idea that antiperspirants might cause breast cancer. There is no evidence at all to support that myth, and women should know that they can continue antiperspirants safely. The guidelines regarding pap smears have changed in the past few years, so we no longer feel it's necessary to have a pap smear every year. Some women have misinterpreted that to mean that they don't have to have an annual exam every year. But in fact, annual exams include much more than pap smears. It's an opportunity to review medicines, to review family history, to find out what sort of problems are happening in one's life, and to practice preventative medicine. So to look for breast lumps that a woman may not notice herself, to check the pelvic exam and see if anything has grown or become abnormal, and to talk about diet, exercise, and healthy lifestyles. So it would be a mistake to avoid the annual exam just because you're up to date with your pap smears. Back in 2002, the Women's Health Initiative published a study that reviewed the risks and benefits of hormones. And they found that hormone treatment in menopause does have some risks. But in medicine, whenever we decide whether or not a treatment is appropriate, we're always balancing the risks and the benefits. hormone treatment for women also has a lot of benefits in menopause. So if you have a high-risk condition, it may not be right for you. But if you're someone who will get a lot of benefit for hot flashes, night sweats, insomnia, vaginal dryness, quality of life, that it may be well worth the small risks that are entailed by hormone treatment. Menopause usually happens at the average age of 51 or anywhere between 45 and 55. If menopause happens younger than that, we often consider it a premature menopause or premature ovarian failure. That has rather significant consequences for women because the issues of menopause, such as osteoporosis, heart disease, skin and hair changes, vaginal dryness, all happen 10, 20 years earlier than they would with a natural menopause. So we have to be very concerned about the health risks of a premature menopause. Continuously, the lining of the uterus gets thinner and thinner and thinner until there is nothing to come out. So there's no fear of the blood going to the wrong place or not coming out or building up. In fact, it's quite safe to take the pill continuously and not have periods because of it. Anytime you're on the pill, so taking the pill continuously has the same efficacy in preventing pregnancy that it does to take the pill in the old-fashioned way. In fact, it probably works even better because you're not having the receptive lining of the uterus that you would have otherwise, and you're not having as much problem from women forgetting to take a pill. The worst time to forget a pill is after you've been off for 7 days. And so by never taking a 7-day break, you're much more likely to stay with the program. Women should understand that when it comes to the use of condoms after menopause, the purpose is not to protect against pregnancy. The purpose is to protect against sexually transmitted diseases. It's just as common to get sexually transmitted diseases after menopause as earlier in life. There has been some controversy about pap smears as women become older. In fact, the new guidelines suggest that women over 70 do not need pap smears. If a woman has had no new sexual partners or is not in a high-risk relationship and has had negative pap smears and negative HPVs, then she may not need pap smears after 70. But any high-risk behaviors should still be monitored with pap smears. Certainly a myth to think that premenstrual syndrome is all in the mind. Over time, we've come to understand how the changes in women's hormones can affect many things about their bodies. So during the 2 weeks prior to the period, many women will experience more fluid retention, more mood changes, more breast tenderness, bloating, a whole series of symptoms that do relate to measurable hormones in their systems. Many women feel that because they don't have a family history of breast cancer or ovarian cancer, they don't need to worry about those cancers. In fact, 80% of women to get breast cancer do not have a family history, and the large majority of women to get ovarian cancer do not have a family history. So the absence of a family history does not mean you're safe. If you have breast and if you have ovaries, they need to be checked. Some women are concerned that they would not be able to have children if they have ovarian cancer. In reality, most women with ovarian cancer need to have removal of their ovaries. And removal of the ovaries means that they would not be able to ovulate and therefore would not be able to have children of their own. Many people have thought that fertility drugs can cause ovarian cancer. One of the risks of ovarian cancer relates to the number of times you ovulate in your lifetime. By taking fertility drugs, you may ovulate more than once in a given menstrual cycle. However, if you do become pregnant, it more than makes up for the fact that you ovulated more than once, because then you go 9 months without ovulating during the pregnancy and up to another year without ovulating while you're nursing. So it balances out, and the meta-analysis looking at really large groups of women who've taken fertility drugs does go to show us that there is not an effect on the risk of ovarian cancer. Women have been very worried that they won't be able to breastfeed because they have small breasts. Nature has done an incredible job of making small breast equally competent at producing adequate milk supply for babies. It would not be the case that one should not breastfeed a jaundiced baby. In fact, when a child has jaundice, it's very important that they get more fluids and that they be very well hydrated. And so frequent nursing can be useful, as well as extra water in between nursings. Some couples, when they are undergoing fertility treatments, may be concerned that having sex too often means that there won't be enough sperm available when they do want to become pregnant. That's not the case, that it only takes one sperm out of many million to conceive. It is true that if a man has sex every day for many days in a row, the number of sperm in a given ejaculate will decrease, but it does not decrease so much that it would mean one could not become pregnant. Some people think that they may be able to tell the sex of their baby by listening to the heart rate, and that perhaps a high heart rate means a girl and a low heart rate means a boy. In reality, one cannot judge the sex of the baby based on the heartbeat. There are many myths about how to predict whether the sex of your baby is a boy or a girl. One of those myths is that it depends on how you're carrying the baby. In reality, the way you carry the baby has much more to do with whether it's your first or your second, what your body habitus is like, whether you're tall and thin or short and round. So the sex itself does not affect how, or the sex itself does not tell us. We cannot predict the sex of the baby by looking at the way you're carrying the child. There are many myths surrounding ways to tell what the sex of the baby is. Sometimes people look at whether your cravings are for salty food or sweet food. They may look at how much nausea you have early in pregnancy. Those kinds of changes in pregnancy really don't reflect the sex of the baby. I think as a gynecologist, one of the most exciting things to me in this field has been the development of the Da Vinci robot to aid in doing hysterectomies or other pelvic surgery for women. With the use of the robot, we can use very small incisions. We can get much more adequate visualization of the surgical fields. We have less blood loss, less tissue trauma, and dramatically improved recovery time for our patients. I think the name just has to do with the idea of being very inventive and intuitive. The company that makes it is called Intuitive, and in fact it is very intuitive. One uses natural hand motions, and they're exactly replicated inside the patient by small, precise instruments.